Yeah, so I like Dom's title, What's It All About? So mine's now What's It All About Part 2, and talking a bit about ethics and generation genome. So Ellen said some of this, but this is just putting me in a context. I'm based in an NHS genetic service and a genome medicine centre. I run the Practical Ethics Genomics England Clinical Interpretation Pathway, taken in from Bill as chair of VSGEM, and I run a research group in Southampton University called Clinical Ethics and Law, which is broadly about ethics in clinical practice, but is focusing very specifically on genomics at present. The things that Ellen asked me to talk about were some of the ethical issues, broadly speaking, as they arise, and what I'm going to pick out using some case examples is the fact that genomic testing can uncover familial factors, and therefore uncovers questions about what responsibilities we as clinicians might have to others, or who holds those responsibilities, and who in fact is the patient once we start doing familial studies because of one particular person presenting.